prostate cancer, probably secondary to better treatment. Colorectal cancer, the green line, going down because of screening and better treatment. And stomach has gone down substantially, and that's really related to the fact that we don't have to smoke our meat anymore. Canning is much better. So substantial differences in stomach cancer related to just our processing of foods compared to the early in the last century. Women, you should be ashamed of yourself. Not these women in here, obviously. But you can see that you took up the bad habit of smoking in the 60s when you became, what was the slogan? Somebody help me out. Gosh, I can't remember what it was, but it's a great marketing campaign that got women to start smoking. And it had an impact. It started causing lung cancer deaths. But you see that breast cancer is going down, secondary to early detection and better treatment. Uterine cancer, that blue line, or correction, it's the light blue line. That's secondary to the pap smear, and then colorectal coming down because again of screening. So tobacco is very interesting. You can see that this is the age-adjusted death rates for lung cancer, and this is tobacco consumption over here, or cigarette consumption per capita. And you can see that in 1900, lung cancer was essentially non-existent. And I can remember reading old textbooks in medical school that said if a surgeon came across a lung cancer in the operating room, the entire medical school was called into the operating room to see what one looks like. When I was in school in the early 70s, it was just incredibly common. You can see that per capita consumption went up substantially with World War II. Right here, sort of an exponential rise. Does anybody know why that was?
Government paid for cigarettes?
Yeah, so the government gave cigarettes to all the GIs overseas. So cigarettes were given to every single GI. They all became addicted, came home addicted, and it wasn't until the Surgeon General's report in 1965 that you actually saw cigarette consumption go down. And then look at the mortality rate, the lung cancer death rate, followed about a decade later going down. So there's absolutely no question that that has a major impact. Women are starting down because they are starting to quit smoking, so that's good. So men peaked at 52% smoking rates and are down now to about 24%. Women peaked at about 34% and are down to about 20%. But that's still totally unacceptable. Places like California are down to 11%. And we believe we can get those rates down to single digits. I don't think we can ever outlaw it because it'd probably become like a black market, and people would probably start shooting each other like the drug cartels over tobacco. So I think we probably learned from Prohibition that you can't actually outlaw it safely, and I don't think that'll ever happen. But I think with education, we certainly, and policy, we can get the rates down. There are two things that really impact it. One is taxes. So the higher the taxes, the lower the smoking rate. Makes sense. Most of the people that are smoking obviously are relatively uneducated and low income and adolescents. And so if you raise the tax, then consumption goes down. The other thing is clean indoor air laws. So the state of Alabama, in its infinite wisdom and this is where you can have an impact, does not have a clean indoor air law statewide. It's one of only about 11 states in the nation that does not have a statewide clean indoor air. That doesn't take an appropriation, and it doesn't take a tax increase to have a clean indoor air law. But the harder you make it for somebody to smoke, that is, they have to go a distance, particularly during work, they actually stop smoking because it just gets too inconvenient for them. So it actually has a major impact on, on tobacco consumption. So you should all be advocating with your state legislature for a clean indoor air bill. And we'll be actually promoting one in the next legislative session, so we'll need your help with that. And then in a couple of years, we're going to need to ask that the taxes go up. We're 56 or 43 cents a pack. New York is $4.28 a pack. So we're among the lowest states in the union in terms of our tobacco tax rate. Now, this is something you don't know or might not know. So this is the impact of body mass index on cancer mortality. So if you are obese, this is for women, the relative rates of cancer for almost every cancer go up substantially. And you look down there at uterine cancer and kidney cancer, pancreas, esophageal, anywhere from 2 to 6-fold increase in mortality rates based on body index alone. And this is in no smokers. These are in men and women who have never smoked. And for men, you see the same impact. So there's no question, epidemiologically, that obesity is a substantial relative risk for cancer mortality. The public doesn't know that. And just to put it in another perspective, endometrial cancer, esophageal cancer, mouth, pharynx, larynx, stomach, colorectal, pancreas, you see the proportion of cancers that are attributable to poor diet and obesity. So this is a tsunami that's coming at us right now. And even other cancers, all the way down to prostate, about 11%. So this is a tsunami that's coming right at us because you can't live in this section of the country without having observed in the last 20 years a substantial increase in body weight on average. And that's confirmed, obviously, by data. So look at this. This is physical activity. So you can see that if you have less than a high school education, your chances of leisure physical activity is pretty low. This is one of the more frightening slides that you'll see. And all of you have children, or a lot of you have children in these age ranges. So if you look at the bars, you're talking about the one on the far left is 1971 to 1974. The one on the far right, the pink, is 99 to 2002. So this is children. So when I was in medical school in 71, 5% of the 2 to 5-year-olds, 4% of the 6 to 11-year-olds, and 6% of the 12 to 19-year-olds were defined as obese. Not overweight, but obese, a body mass index of greater than 30. The 12 to 19, that has tripled from 6 to 18%. That is a significant health problem that we're facing as a nation, because it's not only cancer, which I showed you, 35% of cancers attributable to this, but also cardiovascular disease and diabetes. This is adults, same problem. You can see substantial increases, 3 times the rate of obesity. This is mammograms. So I told you that 40% of women do not get mammograms on a regular basis, and you can see that it's much worse for women who have less than a high school education or have no health insurance. So the rates are substantially lower. And if you look at this, which is disparities, you can see that when mammograms came on board around the early 80s, so now you had something that made a difference in outcome, you began to see difference in death rates between African Americans and whites. And that was simply because whites were more likely to have insurance, more likely to have access, got mammograms on a more regular basis. It impacted their mortality. African Americans less likely, so their mortality stayed about the same. So that's a significant problem. I'm going to skip over to colorectal screening, and you see the same phenomena. So colonoscopy became available around 1980, and before that there was no difference in mortality because there was no way to detect it early. So everybody showed up with late cancer. But as we began to develop, or we had the discovery of colonoscopy, or screening for the disease, it was provided in a disparate fashion, and therefore health disparities came into existence. And you can see that's for both. And this is the frightening and why probably the health care reform package is going to ultimately make a difference. So if you look at the red line, that's stage